Hello, welcome back to my YouTube channel. This is Dr. Roja. As you all know, I've been making several videos on different types of mental disorders. And for those of you seeing me for the first time, please do subscribe and share this channel. Last video, we have discussed about mini mental state examination, and this video we are going to see about personality disorders. From the figure itself you can see different types of personality disorders here, like schizoid, dissocial, dependent, antisocial, schizotypal, avoidant, borderline. Yeah, you can see from this figure we are going to see about all these types of personality disorders, and I have got a beautiful picture for you, just showing different shades in a person. Yeah, so we will just go ahead with what is meant by personality. Personality in a simpler way is defined as sum total behavior of an individual. If you would like to define like normal personality, here it is defined as a characteristic pattern of behavior or modes of thinking of an individual. So we have modes of characteristic pattern of a behavior or modes of thinking that determine the person's adjustment to environment. It includes factors such as intellectual abilities, attitudes, beliefs, moral values, and emotional reactivity. That's what personality is defined as, a sum total behavior of an individual and how he adapts to the environment or how he adjusts to the environment in which he is placed. So when we say personality of a person, we take into consideration his physique, height and weight, color, eyes, hair, everything. Apart from that, intellectual abilities, capacities, attitudes, the way he deals with the different problems when he is placed in different environments, his beliefs, moral values, emotional reactivity. All these things define a person's personality. And this normal personality usually is developed from the time child is born, what he learns from his environment. And as he grows, he tries to make changes to his personality. But by adolescence, certain patterns of behavior do exist in the person and they continue throughout their adult life. And these patterns of behavior, if they are maladaptive patterns, there we see personality disorders. So this normal personality, it includes certain features like present since adolescence, stable over time. Despite of fluctuations in mood, still these patterns of behavior are stable over time and they manifest in different environments. Suppose if we just take like these manifestations can be shown very clearly when there is an environmental change. Suppose you would have joined for nursing, and all of a sudden you're placed in hostel. Different people cope in a different way, isn't it? So that depends upon what type of personality they have. Some adjust well, some do not adjust. They want to leave hostel and just go off. Some say I'm finding it difficult. That's all. It depends on the person's personality. So manifest in different environment, recognizable to friends and acquaintances. Coming to personality disorder, according to WHO, abnormal personality can be defined as deeply ingrained maladaptive pattern of behavior. Deeply ingrained maladaptive pattern of behavior, and this pattern of behavior will continue throughout the most of the adult life. And adult life, it is continued. By the time they reach their middle age or old age, they become little bit less obvious because a lot of emotions do reduce by the time they reach middle or old age. And maladaptive behaviors, usually these personality disorders, we see them having loneliness, suspiciousness, withdrawal behavior. And when we say personality disorders, they come under maladaptive range of behaviors. The degree of adaptiveness is not normal, and as a result there are presence of certain signs and symptoms. So next, coming to some characteristics of personality disorders, we say this is not considered as mental illness. It is an maladaptive behavior. They have problem with adjusting to the environment and adjusting to themselves. And this personality disorders cause problems with their relationships, lifelong problems with their occupational functioning, with their relationship, with their understanding about themselves, social functioning. They produce a lot of discomfort in person. They create anxiety, restlessness, as well as they cause some trouble for others as well. So as a result, personality disorders is different from mental illness. They are continuous. They start from adolescence or sometimes even before. These patients are not mad, but they are little bit odd. Coming to etiological factors, under etiological factors we have genetic factors, development factors, social cultural factors, and psychosocial stressors or psychological stressors. So under these factors we are going to see each in detail. First, coming to biological factors, we have genetic factors that involves hereditary. So like from inherited traits are present in each one of us from our parents. We have this, and they influence our personality. That is one thing. Then intelligence is from our parents. Physical characteristics, phenotypes are from our parents. So we say personality, it is a sum total of an individual behavior. And apart from that, we have neurotransmitters which contribute. So initially itself, if you just look at different disease conditions, what we have discussed, we have also discussed about neurotransmission, how neurotransmitters are very much important, and how deficiencies in them or increase in them also cause different types of disorders. So in personality disorders, most commonly, majority of the personality disorders, they have identified that there is a low level of serotonin. And if there is any family history of alcoholism, other psychiatric problems, prevalence will be more. Especially among cluster A type of personality disorders. Under personality disorders, we have different clusters like cluster A, cluster B, cluster C. So we will just go through cluster A like now schizoid, paranoid, schizotypal, and cluster B consists of histrionic, then emotionally unstable or antisocial personality disorders, then narcissistic, etc. Cluster C's are mainly having this anxiousness and fearfulness. So they come like dependent personality, anxiety personality disorders, and other personality disorders. Anyway, we'll go in detail regarding that. But especially if we see in cluster A personality disorder, there is low level of serotonin which is absurd or abnormality in serotonin levels. Coming to developmental factors. So as each individual grows from childhood to adolescent, everything matters. During childhood, if they are placed in insecure environment, if there is loss of loved one or attachment figure, either it may be the mother or a grandmother or caretaker, whoever it is, where the child grows, is very important. If you just look at psychosocial development and psychosexual development of personality, you can understand, like trust versus mistrust, autonomy versus guilt, and the fixations where they are fixed at oral stage or anal stage, phallic stages. These stages are very important during childhood. If the child is having mistrust because of constant changing of primary caregiver, or if the child is grown in an environment which is unsafe, physical abuse or sexual abuse, which causes a lot of trauma to the child, these traumatic experiences, lack of love and affection from parents, lack of security, all these will cause lot of trauma and influence. The memories which just are hidden in unconscious part of our mind will show the maladaptive pattern of behavior. Next, coming to socio-cultural factors like isolation, long-term psychiatric problems, chronic institutionalization, sending children to hostels at a very early stage where they are to deal everything by themselves, and some cultural practices, immigrations, moving from one place to another place, lack of close family ties which promotes loneliness. Then other things, we have psychodynamic factors, what I have said, like fixation at oral stage, anal stages, phallic stages. They cause a lot of anxiety in individual and sometimes increased autonomy, separation from loved ones, lack of coping mechanisms, abandonment, left aloof, dependency, passive behaviors. All these together, these factors together contribute for developing personality disorders. Now we are going to discuss about each personality disorder in detail. We have, as said, like different types of clusters, like cluster A, B, C. This classification is according to DSM-4 and Axis 2. So under cluster A, there is odd and eccentric. As I have mentioned before, we have paranoid, schizoid and schizotypal. And cluster B is dramatic, emotional, and they are erratic. It deals mostly with emotions, attention seeking behaviors. Here these people are shy, self-centered. And here in cluster C, they more common what we observe is these people are anxious and fearful. So here we have dependent type of personalities. So under cluster A, as said, we have paranoid personality, schizoid personality and schizotypal personality, and we'll go in detail regarding these conditions. And as said, cluster B, it has antisocial personality disorder, histrionic, narcissistic and borderline personality disorder, which we can also call as EUPD. Exam point of view, this is very important. EUPD, emotionally unstable personality disorder or otherwise borderline personality disorder. Sometimes they can ask this also, antisocial personality disorders. In 2 marks they will ask, now what is meant by narcissistic personality disorders. Next, cluster C, avoidant personality disorders, dependent and obsessive compulsive personality disorders. So we will go into each personality disorder in a detailed way. First, coming to paranoid personality disorder, you already know, those who have gone through my previous videos regarding schizophrenia, you will understand what it is. So paranoia means mistrust. They do not trust others. They are suspicious. And this suspiciousness is mostly seen in males. Males doubting females. Husbands who doubt their wives. And because of their distrust and constant suspiciousness that others are having sinister. What is sinister? That means unfaithful, as if the partner is unfaithful, trying to cheat that person, cheating. Others are having these types of motives. So they try to observe the person. As a result, relationships do fail. And person with hidden meanings, they have this disorder. Like whenever we just talk to them genuinely, also, but still they think like, what is the intention behind what she says? What they want to convey to me? And there is presence of hostile intention in everything others say or do. They suspect like that. So paranoid schizophrenia is like that. So here are some signs and symptoms as said: suspiciousness, mistrustful, argumentative, stubborn, self-importance, very sensitive, jealous and irritable. Next, coming to schizoid personality disorder. Schizoid, shy, very shy. Schizoid, very shy. Detachment and social withdrawal. They like to be for themselves. That's why they are called as loners. They don't have many friends. They don't engage in social activities. They have their own interests. And occupation, no close friends. They stick for themselves. They maintain social distance even with family members. They are not that very comfortable. They are not concerned with others. This is the core feature of this schizoid personality disorders. So emotionally cold, that means lack of concern towards others, lack of feelings towards others. They don't have much concern. They don't think, humorless, aloof, most of the time introspective, no desire for enjoyment of close relationship, inability to experience pleasure. That is called as anhedonia. I hope you remember anhedonia. Anhedonia means not able to feel pleasure. Next is schizotypal. Here, very odd thinking. Behavior, pervasive pattern of social interpersonal deficits, acute discomfort with others. You need to know the difference between schizoid and schizotypal. They are also shy, aloof, alone. They like to stay for themselves, withdrawn from others, lack of social relationships. And here also we find that, but two other things are added here. They have inappropriate affect, odd beliefs and magical thinking. People build castles in air. Magical thinking, too much of creativity, which are very odd. Neologisms like coining of new words, odd, eccentric, peculiar behavior, not fitting easily. They can be identified because the way they talk with others is very peculiar. So these are all some of the personality disorders which come under cluster A: paranoid, schizotypal and schizoid. Next, coming to cluster B, here they are very dramatic, emotional, erratic. So attention seeking behaviors are very common here. Self-mutilating behaviors are very common here. Blackmailing behaviors are also very much seen. Coming to antisocial personality disorder, we can also address them as sociopaths or psychopaths. So here we can define this disorder, which is characterized with chronic antisocial behavior and they violate the rules, societal norms. They invade the privacy of others. They create violence. They have criminal type of behaviors. So, like hitting others, bullying others, even in family or school or work area, they don't respect the norms, societal norms. So, as a result, what happens? Failure to sustain relationships because they become very aggressive, try to hit others, harm others, abuse others, impulsive actions. They cannot tolerate, low tolerance to frustration, tendency to cause violence, and they don't have any feelings of guilt after causing violence, inability to maintain close personal and sexual relationships. As a result, which leads to unstable relationships. These people are cruel, crude. Next, coming to histrionic personality. Here, in histrionic personality, here we say a person has attention seeking behaviors, ASB. Very unstable in relationships. Very easily they get attached to person and detached to person as well. They like others to notice them. They seek for momentary excitement but not meaningful. Fleeting adventures are very common in them, and this is very common among females. Being a female, we can understand, like we have this the feeling that others should appreciate us or look at us or just comment on how we are, and we like to hear that is there. So in histrionic personality disorder, here they want attention of people at all the times. So for that sake, they try to blackmail also. They try to do emotional blackmail, dramatic emotionality, angry scenes, demonstrative suicidal attempts, try to cut their wrists, attention's lack of consideration for others, attention seeking behavior, self dramatization. They long for recognition. So if you go back to conversion disorders, there we have discussed about this hysteria, condition called as hysteria, and other types of behaviors like hysterical fits, which we call it as pseudo seizures, then pseudo anesthesia, etc. Next, coming to narcissistic personality disorder. These people are self-centered, self-absorbed, lack of empathy for others. So now narciss, this word, this terminology itself, narciss, is derived from this person, narciss. He lived in European countries, and he is a person who used to go for a walk in his garden, and one day he saw himself in the lake and started admiring himself. He's so self-absorbed, and he started admiring, getting so engrossed, self-centered. One day he fell into the lake and died. So from that time, narcissistic personality disorders, they admire themselves, they get engrossed in their own thoughts, they don't have empathy or concern for others, they use others for their benefits regardless of how others are feeling. They take advantage of people to achieve their own goals, and they does not show any concern for others. Arrogance is there, attention seeking, dramatic behavior, unable to face criticism, lack of empathy, arrogance, exploitative behavior. Next, coming to borderline personality disorder, this is very important as said. This is also called as what? EUPD, that means emotionally unstable personality disorder. So here the persons will be having instability, emotionally unstable. And this instability is present in their relationships, moods, behaviors, and self-image. So, four main categories of signs and symptoms under this: unstable relationships, unstable self-image, unstable emotions, and impulsivity. So, as a result of unstable relationship, they get lonely. They do not understand themselves, how they behave. As a result, they try to attempt some suicidal attempts, blackmailing, emotionally very unstable to predict how they will behave. At one point, they'll be very happy, the next moment, they'll be very sad, very impulsive at times. They try to break things, throw things, cut themselves, shoot themselves instantly. Very dangerous. Emotionally unstable personality disorders. I'm working with few of them here. Most of the time we see them head banging, trying to ligature themselves, like involve themselves in ligaturing, cutting their hands with sharp objects. One day they'll be very happy, the other day they try to attempt. Next, other signs and symptoms include lack of control of anger, suicidal threats, as I already said, uncertain about their personality, personal identity, chronic feelings of emptiness. They really can't understand themselves. Next, coming to cluster C, anxious and fearful. The core feature here is they have anxiousness and fear in them. So first one is avoidant personality disorder. Because of low self-esteem or low self-confidence, negative thoughts about themselves, inferior feelings about themselves, they have difficulty approaching persons. They are sensitive to criticisms. They try to avoid interacting with others. They try to just stay for themselves because of their insecure feelings. They try to have fear to just address persons or social gatherings. So most of these personality disorders, they have different types of phobias as well. So fear of disapproval, rejection, unwillingness to become involved with people, shyness, insecurity. And these people have, as said, social phobias, anxiety disorders, OCDs, somatoform disorders, depressive disorders. Next, coming to dependent personality disorder. Here we say like these dependent personality traits, the types of behavior, they develop from their childhood. Where we see small children just clinging to the mother, just moving around, and they don't want to leave their parents. They have this fear of separation or rejection. They don't like to just stay alone for themselves. They just depend on others to make decisions for them, either friends or parents. And for that type, like they, because of their dependent personality disorder, they become so submissive, and they have very low self-esteem and low self-regard for themselves. They just want someone's support, reassurance constantly. So this is about a dependent personality disorder. Some of the signs and symptoms which are mentioned here are feeling uncomfortable and helplessness, inability to make decisions, low self-esteem and lack of self-confidence, hypersensitivity, etc. Next, coming to obsessive compulsive personality disorders. So in this, like we have discussed about OCD, obsessive compulsive disorder. So these persons are like they want to be very clean, perfect, and they like to follow some rules, and they believe whatever they follow is the only right way, and they follow this right moral principles, perfectionism. Most of these persons, they place themselves in a higher position, and they make the other persons to follow whatever they say. Some of the things like where we see in this personality disorder signs and symptoms, feelings of excessive doubt and caution, perfectionism, craving for high standards, etc. So these are all different types of personality disorder. I think I'm very clear on these conditions. We have three types of conditions, like clusters, like cluster A, B, C, and cluster A mainly odd and eccentric. Just believe that they have this paranoid, schizoid, and schizotype all will be coming under that. Then cluster B, we have dramatic, emotional, erratic. So under that we have like antisocial personality disorder, we have seen histrionic personality disorder, we have seen then narcissistic personality disorder, also we have seen borderline personality disorder also. Then under cluster C we said anxiousness and fearfulness is very common. So avoidant personality disorder, dependent personality disorder, and obsessive compulsive personality disorder. Coming to treatment part of it, we have anxiolytics and anxiety. We said last one, cluster C, we have anxiousness. So we treat them with alprazolam or diazepam, Librium, any of this, as per the choice of psychiatrist and as per the signs and symptoms present in the person, they select. Then apart from that, like we said, low levels of serotonin, SSRI, selective serotonin reuptake inhibitors, can be given, especially in cluster A type. Antipsychotics are mostly preferred, like cluster A, like schizoid, paranoid type of personality disorder, olanzapine, haloperidol, droperidol, all these drugs are given. Apart from that, based upon the signs and symptoms which we see in these personality disorders, drugs are prescribed. Then apart from psychopharmacology, we have this psychotherapies. Apart from this psychotherapies, what we are going to discuss, we have this recreational therapies, diversional therapies, occupational therapies to divert them. So coming to psychotherapies, we have psychodynamic treatment, insight oriented therapy. Now insight is being aware of what they are actually suffering with. And we have seen like under etiological factors, under developmental factors, we have seen like traumatic past, sexual abuse, physical abuse, detachment from parents, immigrations in under social cultural factors. So various factors what a child face during the childhood, and these patterns of maladaptive behavior continue through adolescence and they land up into personality disorders. So in insight oriented therapy, we are going to focus on the unconscious processes and explain to the person that the past experience is the main one which is leading them to have this present personality disorders. So we see that they gain some self-awareness and understanding about their past and present behavior, how it is influencing. That is insight oriented therapy. Next, coming to cognitive therapy. So cognitive therapy we have discussed in my previous videos several times. If you can just go back and see, it will be very nice. So cognitive therapy, it mainly focuses on our thoughts, beliefs and emotions, thoughts, feelings and behavior. So beliefs are one thing, like what we believe, we think on what we believe. So beliefs leads to thoughts, and thoughts lead to emotions, and emotions will produce actions. So if beliefs of the person are altered, definitely thoughts also can be changed. Their pattern of thinking will be changed, which will bring about different lead to actions. So here in CBT, they are going to focus on these thoughts, feelings and behaviors. So apart from this, I said recreational therapy is important, then diversional therapy, occupational therapy is important. Then coming to nursing management part of it. In common, I would like to say, like, coming to antisocial personality disorder. We know they are having this criminal behavior which is harmful for others. So we set limits for that behavior by providing safe environment, taking verbal contract from the patient, then explaining the rules and regulation and consequences of their behavior, removing harmful objects, and constantly observing the behavior of an individual. Along with this treatment, psychopharmacology and psychotherapies, as a nursing personnel, we need to do this. Not to encourage any antisocial behaviors in the surroundings, and if they do so, what are the consequences of such type of behaviors. Then apart from that, if you just take like any histrionic type of behavior, cluster B's type of behaviors, like because they have this dramatizing behavior, blackmailing behavior and all those things, we are not supposed to pay much attention towards them. At the same time, we need to provide safe environment, because histrionic type of behaviors, because they are seeking attention, and the moment we try to pay more attention, the more they repeat that behavior. So that's the reason we should ignore the behavior of the patient, but try to focus on the root cause of the problem and try to provide cognitive behavioral therapy and ask the person to ventilate himself or herself. Coming to borderline personality disorder or emotionally unstable personality disorder, as we said, like they become very aggressive. So we should provide again safe environment to the person, talk to the person, take verbal contract, and constantly observe the person if they are trying to mutilate themselves or cause some harm for themselves. Remove harmful objects. Constantly watch the person. Ignore at times if they're trying to bang their head, and at one point they get pain and they'll come back. So certain things, like we as a nurses, we need to have constant observations on certain types of personality disorder, especially antisocial, emotionally unstable personality disorders. Apart from that, regular medications and involving them in other therapies, recreational therapies and diversional therapies are very important. I hope this is all about personality disorders. So I hope you have understood, and I have been very clear in explaining. To summarize, we said like personality is defined as like sum total behavior of an individual where a person adjusts, and if there is any maladaptive behavior, we say it is a personality disorder. Different types of personality disorders we have discussed, and the treatment aspects also. So they might use anxiolytics if there is stress or anxiousness, and if they are having this any psychotic conditions, personality disorders, then maybe antipsychotics are given, etc. So this is all for now. Thank you all very much for listening to my video. Please don't forget to subscribe and share to others. Anyway, we'll meet soon with another video. Thank you all very much. Bye.